All right. So Taylor, I got to ask you something. Is any tan safe? Some people say, hey, before I go to Florida, I want to get a base tan. What do you think of that?
So is any tan safe? I think maybe a spray tan, a fake tan. I think a fake tan is safe. I should advocate for that more often. But no, if you're activating your melanocytes, it truly is not safe. There really is no safe tan. They've done so many studies on this. Some people think if you're avoiding those really painful extreme sunburns and you're avoiding skin cancer, and that's why they think that the base tan will be protective. These are just people that aren't educated in skin cancer. They're just coming up with assumptions. The researchers that have done studies on this, they've shown there for sure is just an increased risk in skin cancer with this base tan theory, with just any sort of tanning.
In my mind, you're actually just increasing your risk of burning once you hit Florida because your skin is already compromised, and then you compromise it further once you get down there and you don't apply your SPF.
It's just given all those DNA mutations a head start. So tell me this, what is one ingredient you'd ban from all skincare if you could?
Fragrances, absolutely, without a doubt. It is the number one contact allergen in personal care. And the bane of my existence is when brands say sensitive for sensitive skin, and then they have fragrance in it. The bane of my life is when brands market their products as sensitive and they still have fragrance in.
Is it bane of my life or is it bane of
Oh
existence?
my God.
I don't even know. You're
Yeah.
asking the wrong person. Is there a specific fragrance that you would ban?
I'd ban all of them. The problem is they put fragrance on there. They don't have to disclose what the individual fragrance is, or they put fragrance mix 1 or 2. And in those mixes, there are 7 different compounds. So we don't even know, as the allergist or the dermatologist, which individual fragrance they're reacting to. But honestly, if you just ban fragrances, and that includes essential oils, I'd be a very happy man.
How would you do that? Because fragrances, not everything is necessarily classified as a fragrance, but they are aromatic.
You're correct. Shea butter has got fragrance compounds in it. If you've ever smelt it, it smells pretty good. No fragrance is added. We don't have to disclose on the ingredient list that there is any aromatic fragrance, but there is definitely a compound that you can be allergic to in there.
Or like calendula.
100%.
So what would you do? How would you ban all of those? What would you say? How is it even possible?
I don't think it's possible. This is just a dream that is never going to be a reality. But the problem is also if we could just have better ingredient listings that literally say this product contains fragrance. Because if you put something like linalool on there, doesn't sound that bad, right? Or limonene, but that is a fragrance.
Yep.
So Taylor, I've got a question. Do men and women age differently?
Do they age differently? Yes and no. Going back to the basic science of aging, maybe no. For example, men tend to have higher levels of testosterone.
Yes.
They might have more sebaceous hyperplasia on the skin.
Yes.
And that's not to say that women can have it also, because they will. But in general, for example, doing cosmetic procedure, there are certainly things that I would do more for men and vice versa, more for women. So I would say yes. As we grow older, without a doubt, there are things that happen to men and women differently.
My understanding of skin aging, apart from the wrinkles and the sun damage, is fat loss in the face. That's why recently they have this Ozempic face. When a female suddenly loses 40 pounds and she loses a lot of it in her face, she just looks a little sterner, a little older overnight. So I wonder, is there a difference in the fat loss in men's faces versus female faces? Is this something that has been studied that you know of?
That's a great question. I think the fat loss might be similar. Men do have quite a bit more muscle in the face.
So that volume is muscle and fat.
Certainly. Muscle might even be preserved a bit more in the face of men, but I do have to say Botox is changing all of this quite a bit.
Yes.
I always say you want to get Botox enough where it works, but you don't want to do too much Botox where
Yes,
you're
to
losing
atrophy the
that muscle,
muscle.
because we see that in patients that we have patients that as soon as they have one tiny wrinkle, they're running back and they're saying, I need Botox. And I've had to do surgeries for skin cancer where we've gone under the skin and their muscle's non-existent. It's not
Yes.
even there.
Oh my
And you can
goodness.
tell beforehand, there's just something different about the face. The skin itself technically is not thinner, but it just
It
looks
just kind of
almost
hangs
thinner.
over
Yeah.
there. Yeah. Honestly, that's why I tell my wife that's why I chew gum consistently to practice my facial muscles.
But it reminds me, women, when they go through menopause, they've got all these changes in hormones that men aren't going to go through. So certainly they're going to have different changes physiologically on their face.
A follow-up question to that is what is the increase in what I've heard is called Botox? Like, what is the percentage of patients coming in that are females versus males getting Botox?
Overwhelmingly, the majority of cosmetic patients are females. The last time I checked, I think it was somewhere between 92 to 95% of cosmetic patients are females. Over the last year, it's started to change quite a bit in that men are starting to take care of themselves, which is great because why shouldn't it should be 50-50? Why should only females be coming in and taking care of themselves? All right. What would be the most overrated sensitive skin product?
My ingredient, and it's in a very well-known brand, is lanolin. This is such a common contact allergen, yet it is in Aquaphor. They have it in there and they market it to babies for diaper rashes. And I can't tell you, even dermatologists sending patients to me, they're like, this patient's eczema is not clearing up. They use sensitive skin products. One of them is Aquaphor. I'm like, come on, why are we doing this? Why are we still having lanolin in sensitive skincare products? What is yours?
First, I agree. Aquaphor, it feels so
It
nice.
does.
But yes, our pediatric dermatologists, they do not use Aquaphor because in kids, the worry is that the more that they're going to use lanolin, the higher the risk that at some point they're just going to become allergic to it. And so they just nix Aquaphor in general. But I swear every single parent brings their kid in and they're using Aquaphor because it seems like everyone uses it and it does feel so great. But yes, lanolin, it's very common to be allergic to lanolin and it can cause problems all the time. Everyone's always surprised to hear people can be allergic to it.
And you see it in Lana Lips, this new lip balm. And then the worst thing is the nipple creams. Postpartum mothers with raw nipples are putting an allergen on there and expecting it to get better.
They don't realize it. They don't realize they're making it worse.
100%.
So my most overrated ingredient by far, I hate it. I can't stand it. Not because it's inherently bad, but because I think it's doing damage. I can't stand niacinamide.
Oh, I agree.
I think it's marketed as the sensitive skincare ingredient. And because of that, every single skincare product has it. And we know that in low doses, it can be beneficial, it can be soothing, but it's almost every single person has this threshold. And as soon as they reach this threshold of niacinamide that they can tolerate, it's like a bomb goes off and their skin just explodes and gets red and irritated. And if every skincare product is now containing niacinamide, you're going to get pushed over that niacinamide edge and you're just going to get inflamed. Now it's like we should just be avoiding niacinamide in general.
I agree because it's like a cumulative effect, right? If you're using your face wash, it's got niacinamide. Your skin is, okay, I see you niacinamide. Then you put on a serum that contains niacinamide. Then you put on a lotion. And God forbid you put on a sunscreen with niacinamide in. You've layered 4 or 5 products in and you've jacked up the percentage to over what is the recommended dosage. And then instead of getting reduced redness and irritation, you are causing redness and irritation.
Exactly. My patients who are having a hard time with their products, I get that it can be soothing for many people, but for the ones that have the most sensitive skin and they're having a hard time tolerating their products, Niacinamide, I want to nix those products.
Exactly. That's why when I formulated Intoxicated, I came up with a list of ingredients and allergens I don't want in there. And people ask me, why don't you have niacinamide in there? It is not a top contact allergen, but this paradoxical response, especially in people with sensitive skin, I have personally seen so many times that I can't even imagine what the actual incidence in the general population is. So I wholeheartedly endorse that niacinamide should not be in every skincare product, especially not sensitive skincare products.